Hey guys. Hi. It is Dr. Jen. It's good to see you guys. Alrighty, we have a lot of fun stuff, or important rather, stuff to talk about today, which is things that you need to have at home if you get sick with COVID or a loved one of yours gets sick with COVID. Now, before we get started, and it's great to see all of you guys on Facebook joining in. I'm seeing my YouTubers join in as well. We are live on both. It is great to see you guys. Give me 1 second. I'm just 1 second. Just going to share this to my pages, and then we'll get started. And I'll also tell you where the inspiration for this came from too. So 1 second. How are you guys tonight? How are you doing? You guys doing well? I feel like I'm stumbling over my words. And it's not even that late, is it? One more second, and then we're 1 second, and then we're gonna jump in to what's going on. Okay, I think we are shared everywhere. Okay. Hey guys. Hello, hello, hello. Ayel, your mom just tested positive. You got to take a test. God bless you. Okay, guys, there's so much to talk about on YouTube. Nilda, Zachary's Journey, Eric, Robin, Eric Bailey. Thank you guys so much for joining me on Facebook. We got lots of you guys on too. This is a really important topic. And let me tell you one of the reasons why I thought I would talk about this. So today we are talking about 7 things you need to have if you test positive for COVID, or you obviously become infected with COVID, or a loved one does. This is something that I've really thought, especially lately, is important to talk to you about because I actually have a number of family members right now with COVID. I have some family members hospitalized with COVID. It is a really tough time for this entire nation. So many of you are writing in saying you have COVID, you've just been diagnosed with COVID, your family member has COVID. And literally, the chance of any of us getting COVID is exponentially higher than it ever was because so many people in America have COVID. Okay. So let's jump right in because I know you guys like it when I don't do a lot of chit chatting, but when I get to the scoop. So let's jump right in. 7 things that you need to have at home or have on you sort of at home if you become infected with COVID or a loved one does too. I don't know if you guys know what this is. This is a little carrying case. I love this little carrying case, but you open it up and we have a pulse oximeter. Okay. I know you're probably like, what? And many of you probably already have these at home. Okay. Pulse oximeters work. This is actually my office one that I brought home so I could show you guys. You push the little button here to turn it on. And what you do is you open it up. It's almost like a little like closed pin, like a little mouth. Hello, hello, hello. Anyway, you put your finger in there. Okay. Make sure it's turned on, and you see the red. I know the light is kind of in the face, but you see like that little up and down there. So it's working. Okay, hold on. There we go. Okay, so numbers pop up, and I know you're probably like, what is this? So what this is, actually, it was upside down. So this is better. I don't know if you guys can see my reading. This pulse oximeter tells me not only my pulse, which is at 100 beats per minute, which is the top limit of normal, probably because I'm excited to be talking to you guys. So my heart's like, it's not abnormal, but I am particularly excited because I'm talking to you guys. So, and by the way, 60 to 100 is roughly normal, but check with your doctor to see what pulse is right and normal for you. Not only that, but it also tells you, in addition, your oxygen saturation number. Okay, so this tells you in some ways how you're breathing. Okay, one of the things that we've known with COVID, one of the symptoms that people often have is trouble breathing because we know it can affect the lungs. In fact, before we knew it could affect rather all these other body parts, we knew the lungs were affected, and so many people end up with respiratory issues. We know that. I know you know that. So this percentage tells you how well you're satting. That's your pulse ox. I'm at probably about 98% or so. I know you guys are going to ask me. You're going to say, well, what's normal? What's a normal pulse ox? And I thought really long and hard about this. I'm not going to give you a number, not because I'm withholding information, but because you have to understand that depending on what your underlying conditions are and your health status, that number may be different. If you were somebody that is naturally on, say, 2 or 3 liters of oxygen at home because of underlying lung conditions, your normal pulse ox is going to be different than somebody who does not have those conditions, right? So I want to be very clear that with any medical device that you purchase, such as like a pulse ox, I'm going to make sure you go over it with your doctor about what normals you should expect for you and or your family member. Guys, these can be bought on Amazon. I'm not a salesperson. I'm not getting kickbacks. This brand, I don't even know. I don't know anything about this. I'm being very serious. But I'm telling you about this because I think it's an important thing to have at home, especially since so many people in America are getting sick, that if your loved one is saying, oh, my chest feels funny, da, 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 or I'm having trouble breathing, at least you can get some objective data while you're on the phone calling for assistance, emergency assistance, okay? I actually bought a number of these for family members for Christmas this year. I'm not a saleswoman. I don't have a line of these. I'm not selling them, but I do think that, especially given COVID, this can be a really important piece of information for you to have if you or someone you know is sick. And it's super easy. Like, again, I just said, you just open the mouth, hello, hello, put the finger in there, and it tells you what your heart rate is and your oxygen saturation. Okay, that's the first thing. Some of them come in these little carrying cases. There's many brands. You can check them out on Amazon. They're everywhere. Okay. Next thing, you know about this. Hold on, battery low. You know about this. This is the almighty thermometer, right? Now, we also know that temperatures, or rather fevers, are not always the case with COVID. You can have COVID and not have a fever. But if you don't have one of these in your house, your apartment, where you're living, you need to get one. And I say this because you'd be surprised how many people do not have thermometers at home. So if that's you, you need to get one. You might need a couple to keep in different places just in case. I say this because I do have a number of patients every now and then that don't actually have thermometers. So once again, if you're having questions about your symptoms, you want to run things by your doctor, being able to have this objective data to tell us, okay, this is what my pulse is. This is what the pulse oximeter says that my breathing oxygen level is. This is what my temperature is. Of course, remembering that not everybody with COVID will have a fever, okay? Next thing that I think you need to have is gloves. See how beat up this box is? I've had this box actually for years. I don't know where I got these. I probably have had this box for like a lot of years because I rarely use these. But, and you see it's like all like torn up and stuff like this. Make sure you get yourself a pair or a box of nitrile gloves, okay? These are super, super important because, you know, it's one thing if you are sick at home and it's just you, well, that's one thing. It's not that you don't need to disinfect or wash your hands and stuff. No, you do. But it's a little bit different than if you live in, say, a household with a family of 4 or a family of 6 or a family of 2 or whatever. If you are sick with COVID or a loved one is, you need to have gloves. Y'all need to be gloving up pretty much every time you interact with the person that is sick, or if that is you need to be using gloves to wipe down surfaces, to disinfect, to do things like that. You need to get some gloves on hand, okay? If you're taking care of somebody at home that is ill and you need to pick up their dishes, maybe they put their dishes outside their door, you don't need to pick them up with your bare hands. You need to have gloves on to pick them up. By the way, you shouldn't be transferring person to person. I'll get to some tips on how to care for somebody at home who's got COVID-19. They shouldn't be handing you their bowls and stuff. They should be setting them outside the door. You pick them up with some gloves, wash the dishes with gloves on to be as safe as possible. But once again, you know, these things, some of these are small things, but they can be big things. Very important. Next thing is water. Now, you know me, I love sparkling water. I'm not advocating for any particular brand. I just say water in general. It's important when we're sick to stay hydrated. I will say this with a caveat, though. Some people have water restrictions. What do I mean by that? I saw patients today who either have lung issues or kidney issues. Sorry for the sirens. The window's open. But if you have heart issues, kidney issues, lung issues, your doctor might have told you, hey, don't drink too much water. Hey, this is all the water you can drink a day, etc. If somebody has told you that you just can't be drinking water, you need to always listen to that. And if you have questions about how much to drink when you are sick, you need to call your doctor. But staying hydrated when we are sick is going to be very, very, very important. Next thing is this. Now, I know y'all see me talking about masks all the time. In fact, the video I posted earlier today got a lot of backlash from people who don't like me talking about masks, but you know I do because they are so important. I know you probably are saying, yeah, Dr. Jen, you tell us every single day to wear a mask, but this is what I'm telling you about now with the mask, which I did in the earlier video from today. If you are sick at home and there are loved ones in your household, not only should you guys be separated in different rooms, okay? So let's say that I were living with someone who was sick. The goal would be the goal, right? And not every family and every household can do this, but the goal is to have that person stay in their own bedroom. If you have enough bedrooms, and not everybody does, you know, I live in a 1-bedroom apartment, so I understand if you don't, but the goal would be to have the sick person isolated away from those who are not sick. The other goal would be to have the sick person using a separate bathroom if possible, if you have a spare bathroom. The goal would be to have the person who is sick to be, again, isolated and wearing a mask. They need to wear a mask because they are sick. Yes, even though they are in their own home and isolated in their room, when other people may come to help change the sheets or tend to them. And the caretaker needs to wear a mask too, okay? This is a time when you need to wear a mask in your home as if someone else is sick that you're taking care of, and you will be in their presence. You need to wear masks. And also, as I told you before, those of you who are caretakers, you need to wear some gloves too if you're helping change sheets, if you're helping them, bathe, get dressed, or whatever you need to do, because people who are ill sometimes need help. So you need to wear gloves, okay? What else do I want to say about this? Also, keep in mind that you want to be separated. As I mentioned before, you got to be separated, but this is not licensed. If you're sick, you don't need to be in the living room just chilling, watching TV with everybody else. No, 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 no. You need to be in your own space. If you are ill with COVID, that means you stay isolated from the others. And you all wear masks in the home because someone is ill. And that you guys wear gloves and you disinfect, and hopefully the ill person will be able to be in their own bedroom and have their own bathroom for that time being. Also, things like dishes, okay? You're not going to share dishes. You guys know not to do that. But for those, somebody who's taking care of somebody who's ill, you get them food, you get their plate, you make their dinner, you set it outside the door. Does it sound cold and callous? I get that it does, but you don't need to be handing something right to them and possibly exchanging things, okay? And remember, if you do have to get in close contact, and in general, by the way, wearing your mask is important. I know that was a long tip, but I had to go over that. Okay, next, this. All right. You're going to say, which vitamin is that? Which supplement do I take? Well, these aren't vitamins or supplements. I will make a note about that because you guys always ask, which vitamin should I take? What I do recommend is either Tylenol or I should give the generic names, acetaminophen or ibuprofen. Again, I have no stock in either one of these. And remember that both ibuprofen and acetaminophen, one's Tylenol, one's like Motrin, Advil, things like that. They are meant for different people, meaning not everybody can take either one of them. So this is not for me to tell you which one is safe for you to take. This is for you to ask your doctor, hey doc, if I get sick, is it okay if I take some Tylenol? Hey doc, if I get sick, can I take Advil? How much should I take? What should I be careful? This is to give you tips so that you can go to your doctor and say, hey, what do I need to do here? What do I need to, do or not? This will help with fever. It'll help with muscle aches, things like that, headache, etc. Of course, it may not make everything go away depending on how sick you are and what you're sick with, okay? But these are things that will help. Many people. Check with your doctor. I'm not a singer. Last thing is, that was pretty snazzy. Look at that. This is Lysol, but I'm not advocating any particular brand. And I'm not representing any brand, but get your disinfectant out, guys. Okay, we know that disinfectants have been hard to come by a little bit with COVID cases rising, and I know some of you have started stocking the delivery trucks at grocery stores and CVS's and stuff like we had to do back in the beginning of the pandemic. Make sure you are cleaning and disinfecting surfaces frequently. Super, super, super important. I've done lots of videos on how to properly clean and disinfect. I've also done videos on how to make your own disinfectant if you've run out of them in the store. So just to recap really quickly, guys, I want to go through this. Okay, pulse oximeter. I told you I'm getting these for a number of my family members. Family members, if you're watching, well, Merry Christmas. You're likely getting one of these. Okay, temperature. Thermometer, okay? Of course, all COVID cases do not develop fever, but be careful, get a thermometer. Also, gloves. I've talked about this ad nauseum. You need some gloves, okay? And then we got, what do we got? Water, agua. And make sure that you know how much you're allowed to drink based on your medical conditions. Get a mask, because if you are sick at home, everybody in the house needs to be wearing a mask. That's right. And certainly if you are near each other, within each other's vicinity, that needs to happen, guys. Safe better than sorry, my friends, okay? And then, Motrin, Advil, Tylenol, pain reliever, fever reducers, etc. Talk to your doctor to find out what you need to be taking. Okay, so I see a few of you are writing in about other things that you can take. Of course, there's other medications for symptomatic treatment and things like that. This is just a very brief overview. This is not an all-inclusive list. There are other things that likely will be very helpful for you getting over COVID, healing from COVID, your family member as well. But I'm hoping these will give you some ideas. Guys, remember, if you want to know extra tips, some of the tips I talked about on how to take care of your loved one who's sick with COVID, just Google how to take care of loved one with COVID, CDC. They have an excellent page that lists really all of these things that I'm going through, not like the pulse ox and stuff like that. Those are some ideas that I think are important for me, but gives you ideas of things you need to be doing at home. Remember, with COVID cases being on the rise, our chance of getting it is higher than it ever was. So I hope that this was very, very helpful. I'm going to take some questions now and check in and see who's there, because you guys have been amazing. As always, I love you all and thank you all for the stars. Facebook, I didn't even stop in. I think I just started. Thank you guys for sending stars. I so appreciate you on Facebook. And for those of you who are on YouTube, I so appreciate the super chats and I appreciate the super stickers. You guys are amazing. So let me take some questions and some things like that. We're going to go to YouTube first and see what's up, YouTubers. Okay, wait, see. Wait, hold on. Why is this not? Wait, hold on. Hold on. Sorry, maybe I'll have to go to Facebook first because this is not working. Okay, well, I'll just go with what I see right now. Robin D, you're from Milwaukee, Wisconsin. Excellent. Eric Bailey, you said your aunt just passed away at 97. She had COVID-19. I'm so sorry to hear that. I know a lot of people have had this. Comp Repairs, Ozone Park. What kind of doctor am I? I'm a board certified family physician. I should always say that. I always forget to say that to you guys, tell you who I am, because then you guys are probably like, who are you? I'm a board certified family physician. I've been in practice for about 12 years. I am an associate professor at Rowan University School of Osteopathic Medicine. I teach medical students, a course for medical students, third year clerkship, and I also precept and teach residents from time to time. And I see patients. I was seeing patients this evening and I ran home to talk to you guys. So, okay, let's see what we got on Facebook. What have we got, guys? Let's see here. It sounds like this was helpful for you guys. Good. Let's see here. Let me just take a look here. I'm sorry that I know that the live gets less interesting when I start looking. Tawana, thank you so much for breaking that down. And Tawana, you wrote a list of things, supplements. So ibuprofen and acetaminophen are not supplements, but other than that, you got everything on your list right. Honey, thank you for summarizing that for viewers. That's excellent. A lot of you are writing in saying you have all the things listed. One of you just asked Karen the name of the first item. This is called a pulse oximeter. Lots of different brands. Just go to Amazon. It's also called Pulse Ox, a Pulse Ox. Even if you put in P Ox, Pulse Ox, it'll come up. Okay, so you'll see plenty of these. You can just buy these. Let's see here. Many of you are suggesting cough medicine. If you have a cough, absolutely. Fern Washington, you said, how do you make your own disinfectant? Can you share, please? What I will do is after this video is posted, please make sure, those of you who have not liked my page, please do. Those of you not subscribed to my channel, I invite you to do so too. What I will do is when I hit post for this video, I will go back and I will update it with how to make your own disinfectants. I'll put both. I have two parts to those videos, two different ways, like a part 1 and part 2, and I'll put those in the description. If you watch on Facebook Watch, you won't see the whole description, but if you go to my page, go to my Facebook page, you'll be able to read the description. Okay, so that's a really great question. All right, so a lot of you guys are asking about vitamins. Okay, let's see here. A lot of you guys are asking about vitamin. What I will say is, for vitamins and supplements, I would talk to your doctor first. The reason why I feel that way, it's not to say that vitamins are bad. In many cases, they may be helpful, but we have to be very cautious and careful with them. Some vitamin levels will need to be checked or probably should be checked. Vitamins and supplements do need to be monitored. And then also some of the studies with vitamins and supplements are not necessarily conclusive. So, honestly, when it comes to vitamins and supplements, I really prefer that you talk to your doctor about that, okay? All right, guys, let's see. Is there... So, Mikkel J. Carter, you said maybe give them a type of plasticware that people who are sick with COVID can throw away when they're finished eating. That's not a bad idea. Of course, we care about the environment, but we're literally living in a pandemic, and if it helps keep you safer, maybe using paper plates or plastic things may be helpful. Of course, we're always mindful of the environment, but we're also very mindful of people dying from COVID and contracting COVID. So that's not a bad idea if that's the safest thing for you you and your family. So Meckel, thank you so much for recommending that. It says, love Pink Davis. You say that your husband is also using plastic forks and things like that too. So I really, really appreciate you guys mentioning that. These guys have really, really good, really good tips. Let me see what else you guys got. Rufus, hey Rufus. Let's see, Nan, Rosalva, hey YouTubers, you guys are amazing. Nilda, you guys are awesome. And let me see if there's anything else. Let's see here. I'm glad this was helpful. It seems like this was a helpful thing. Chantrice, you're asking about regular latex gloves. Yes, so you can use latex gloves. The reason why I say nitrile is because a lot of people end up actually having latex allergies. And in the medical world, we don't use latex gloves because a lot of patients, some patients actually have latex allergies. So I say nitrile because that's sort of like standard of care that we use these. But you can get latex gloves if you want, totally fine. Just make sure you don't have an allergy to it. So no, you're totally fine. And then what I will also say, how long have we been on? Let's see here. Let's see here. Let me just take, what else we got? Couple things. So, just a couple of things. I want to just also throw in a little word about the vaccine. So I'm going to be coming to you all week with vaccine information. Some videos I've already done that I'll be repeating. Some new stuff I'll be coming out with. You know, Thursday apparently is the day that the emergency use authorization will be decided on for the Pfizer COVID vaccine. That's apparently that's like, oh my gosh. And apparently I heard in the CNN town hall, I think Fauci said that some places actually already have the vaccine, but they're not administering it yet, obviously, because the authorization has not been given. So, I mean, this vaccine, if it gets approved, like we're literally like a hop, step, and a jump, away from it. So I want to make sure that I'm answering your questions. Please understand that I will be getting the vaccine. I am recommending to my patients that they get the vaccine for the most part. I think there's still some stuff that we don't know, information that we're still learning, but by and large, I think what we do know seems like the benefits may outweigh the risks. Of course, we're learning stuff every day, but I know many of you guys ask me, you see me doing these videos on the vaccine, and your first question is, so doc, are you going to get it? The answer is yes. So I will keep you updated. I don't want to keep you guys too long, but I hope this is helpful. Ask me any questions that you have. I do my best to answer your questions. Thank you again for the stickers, the super chats, the super stickers. Thank you guys for the stars. Oh, and also before we go, for those of you who are interested in joining my Dr. Jen Superstars group, you can find that in the description of the video. Don't watch the video on watch because you won't see the link. It's facebook.com/groups. Wait, hold on. Facebook.com/groups/Dr. Jen Superstars/ and that's my group. It's a subscription group. If you guys want to spend Christmas with us, we did a Thanksgiving soiree and it was so much fun. So I'm planning a Christmas Zoom soiree. It's gonna be fabulous, and we're gonna play games. And I'm planning on prizes. Plus, I do like Facebook Lives for my superstars every Wednesday and all that good stuff. So anyway, I love you guys. You're amazing. Stay healthy. I told you I have multiple family members right now with COVID, some in the hospital. Honestly, I'm scared. I'm scared for everybody. I'm scared as a doctor. I'm scared. So stay safe because I love you and I want you all to be safe. Okay, guys, I will see you soon. Bye-bye. Bye, YouTubers. If I can go. There we go.